When I say the word thyroid, what comes to mind? To some of us, it may not mean much. You may not even know what your thyroid is. However, there is another group of people to which when you say thyroid, it means something significant in their life. One afternoon last summer, my sister came over after an appointment to inform me on some news regarding her health. Her doctor informed her that she suffered from hypothyroidism, having this disease attributed to a few of the health problems she had been facing the past year, including the inability to lose weight and become pregnant. My purpose today is to inform you on your thyroid, different kinds of thyroid diseases, as well as treatments available. First, let me brief you a little about your thyroid. Your thyroid is located at the base of your neck and produces a hormone that spreads and is used all throughout your body. Although it is a small gland, it plays a key role in many aspects of health, explains Carrie Volpe. This hormone affects several things, including metabolism, heart rate, and energy levels. Women are more likely than men to have problems and issues with their thyroids. Gianna Polviniuk, endocrinology fellow at Georgetown University Hospital, explained that the reason behind this was possibly due to the influence of both estrogen and progesterone. Now that you know a little bit more about your thyroid, let's uncover different kinds of conditions and how each one can affect your day to day. As you can see, there are a number of issues that come from having problems with your thyroid. The American Thyroid Association's website provides plenty of information for each one of these. If you suffer from hyperthyroidism, your thyroid produces an excess amount of thyroid hormone. It causes several symptoms that may make your everyday life difficult, including nervousness, irritability, heart racing, and difficulty sleeping. It also increases your metabolism, which results in an excess amount of energy. Hypothyroidism is in turn the opposite. Your metabolism slows down, you feel cold, you tire more easily, and you become forgetful. Thyroid nodules is another problem. Typically, with thyroid nodules, you have no symptoms. However, it does increase the hormone that is produced by the gland, and it causes hypothyroidism. These nodules, if they become large enough, can affect your breathing, swallowing, and cause tickling in your throat. Borders is a term used for an oversized thyroid. They can be caused by several things, but one of the main causes is an iodine deficiency. There are also borders caused by Hashimoto's thyroiditis, Graves' disease, and multinodular borders. Cancer is also something that can result from having issues. There are 4 different kinds: papillary, follicular, medullary, and anaplastic thyroid cancer. Papillary is the most common. This cancer grows slowly and spreads to the lymph nodes. Follicular thyroid cancer makes up about 10% of thyroid cancers. It can spread to lymph nodes, but it's more likely to affect the lungs and bones. Medullary thyroid cancer is even more uncommon, by only making up 2% of thyroid cancers, and it's generally inherited. If detected early enough, there is a surgery that can be performed to remove it. Anaplastic thyroid cancer is also less frequent, but it's the most potent. The average survival rate is 6 months, with only 1 in 5 living after 12 months. At last, we have made it to the treatments. There are a number of ways you can treat and manage thyroid issues. In the book, The Complete Thyroid Health and Diet Guide, the safest recognized method is called radioactive iodine therapy. Not only is it the most convenient and less expensive, but 90% of patients that underwent this procedure experience no side effects. There are also medications your doctor can prescribe. Sometimes, however, it might take trial and error to find the right dose and kind that works best for you in your situation. When taking these medications, you have to be careful with the things that you're consuming. Certain things can affect the absorption of these medications. Some examples include coffee, grapefruit juice, and high-fiber foods. And just like there's things that interfere with absorption, there are supplements that may aid in improving thyroid function. Consuming oats, pineapples, garlic, and ginger, just to name a few, can help with the function of the thyroid. In any case, you should consult your doctor before starting anything new. Thyroid gland surgery is also a tactic used in curing thyroid problems. If issues with your thyroid are intense, surgery may be required. Factors that play a role in deciding on whether surgery is the right option include the size of the gland and nodule, failure to radioactive therapy, and how severe symptoms are. Today, I have covered what your thyroid is, diseases associated with your thyroid, and treatments available. It will be a year in August that my sister came to me with her news. I am happy to report that she is no longer struggling with thyroid issues. She has become conscious of her eating, which has turned her life around, and she is already down 55 pounds. It's important to recognize that this can be anybody's story. Your mom, your sister, a friend, or even you yourself can suffer and face the struggle. Awareness is the first step in making sure that you are in your best health.